Twins with two different fathers, is it possible? Twins with two fathers are possible with heteroparental superfecundation and heteroparental superfetation. Superfecundation and superfetation are two rare events. What is superfecundation? Superfecundation happens when there are twins from ovulation on the same day with two different fathers. Two separate eggs were released and fertilization happens during the same menstrual cycle, usually within less than 24 hours of ovulation. The woman had sex with two different men within 5 days before or on the day of ovulation. What is superfetation? Superfetation happens if there is a second pregnancy from two separate ovulations. This is usually weeks apart. The second ovulation can occur weeks or even months after the first. Superfecundation or heteroparental superfecundation. Superfecundation or heteroparental superfecundation is the word for twins with separate fathers. Each twin has a separate father. For this to happen, two things have to happen. You have to ovulate twice, dysbiotic. This is actually not so rare and probably happens in more than 1 in 50 to 100 ovulations. You have to have sexual intercourse with different men within a couple of days to 1 week prior to ovulation. That allows two different sperms to fertilize to separate eggs. Both of these events can happen from having intercourse with separate men on the same day or different days, as sperm can survive for up to 5 days. Multiple ovulations happen in about 1% or more of all ovulations, and more often when you take ovulation-inducing medications. Superfetation. Superfetation happens when a woman gets pregnant again after the implantation of one fetus. For this to happen, the pregnant woman must ovulate after she is already pregnant, and this egg must be fertilized by another sperm. This can occur weeks or even months after the first egg is fertilized, and the result is that one fetus is more advanced in